Doctors of Reddit, what is your most heartbreaking diagnosis?
During my time in the ER, I had a patient with metastasized prostate cancer come in with a severe headache. A CT scan revealed he had a brain bleed due to the metastases, and he likely had only a few days left. When I told him, he teared up and said he was supposed to get married in 2 weeks. So that night, another doctor and I decided to organize a wedding in the hospital. We got an officiant for the next day. His fiancée arrived that night. I remember them sitting together, holding hands, and watching the stars through the emergency room window. She spent the night in the bed next to him, and they held hands all night. They got married the next day, surrounded by a few friends and hospital staff. 2 weeks later, he passed away, married to the love of his life. I still get teary-eyed when I think about it. It was such a bittersweet moment, and one of the most memorable patient encounters I'd had.
Have a patient who is a quadriplegic, bedbound. She is currently 25. At 23, she had a post-drug reaction over the span of 2 days, which left her completely paralyzed, neck down. She was completely healthy prior, traveled a lot, did slam poetry, and was a beautiful singer with a strong voice. Now she is non-mobile, her voice is a whisper, tracheal tube, and she needs someone to help with basic motor functions like itching her own nose. She can't clean herself and therefore wears an adult diaper. She has not gone out to see the sun in 2 years and by far is one of the most charitable, gracious and kindest young lady. Neuromyelitis. Optica. I always put an extra hour to the side for when I go to see her. We will talk, do our nails or watch TV together. I've learned a lot from her life previously, her family, experiences I could never imagine. I always tell my patients that they know their own condition better than I do as a doctor. They have lived it. They know their body better than I do. So to please tell me everything, why they think they are experiencing their symptoms, and what they think may help them feel better. I ask these things before I impose any treatment plan because everyone is so different. We find a treatment plan that works the best together. I love my job, I love my patients, I love helping people. These are the cases that have me awake at night with a heaviest heart.
60-something retired nurse presented with rapidly progressive cognitive changes and odd movements. Workup revealed she had Creutzfeldt-Jakob disease. She was with it enough to understand the diagnosis and simply cried to her husband saying, "I'm sorry for what I'm about to put you through." She discharged on hospice and passed after a few weeks. 30-year-old female came in with some mild difficulty walking and sensory deficits in her legs. We MRI her brain and spine to see these ovoid-enhancing lesions in her brainstem and cervical spine. She had recently emigrated from an underdeveloped country, making us think this was an odd presentation of an infection like tuberculosis. We performed a lumbar puncture and don't see any signs of infection or inflammation, so we have to enlist the help of neuroinfectious disease experts from other institutions to no avail. Over the 2 to 3 weeks she was in the hospital, she goes from walking the halls to a quadriplegic. Eventually, one of the lesions expands to a point where we can reasonably safely biopsy it. The biopsy comes back as glioblastoma. These types of tumors rarely present in the spine and brainstem, and there's nothing we can do to help her. She discharged home on hospice and died a couple weeks later.
My dad is an oncologist. He told me about a woman who declined treatment because her husband threatened to leave her if she lost her hair. He was the only family she had, and she didn't want to lose him. My dad tried to reason with her. He asked if he could talk to her husband, who didn't come to the few appointments she attended. But she refused and disappeared for about 6 months. Then she came back because she had begun to physically decline, and her husband had left her. She wanted treatment, since she had nothing left to lose at that point. But the disease was too far gone and she didn't make it. She was 25. That's definitely one of the more devastating and infuriating stories he's told me. Edit. Arguably, the worst part is that this isn't as isolated an incident as you might think. The whole reason my dad told me the story is because someone told a very similar story on Reddit. I mentioned it to my dad, and I said, "I think it must be fake, though. No one is that evil." Which is when he told me he'd seen it before, and more than once.
Most patients in the pediatric oncology ward, really. I remember my first time on that ward, about half a year into my internship. I was tasked with putting an IV access in, and then to take a blood sample from this young and long-time patient of that ward, like many Pied 1C patients there, to send to the lab to get new blood to transfuse for her. To preface, putting an IV access is already much harder on kids than it is for adults, and if the kids are cachectic, super young, and their veins have been poked at for years and years for treatment, then that task gets exponentially difficult. At that point, I was used to kids who would cry and tear the room down when they even glanced at a needle. This ward was different. Me being more or less a very green, fresh doctor at the time must have seemed to be noticeably anxious because this patient looked me dead in the eyes and in the calmest manner said, "Doc, don't worry, I'm not gonna fight you. This is just my life. Get it over with." She took the stick to her vein, emotionless, then went right back to scrolling through on her iPad. That was when I understood her words. That normal life for them included getting needle sticks from unfamiliar doctors and nurses, hospital beds, having to hear other babies cry all day, every day. All doctors get desensitized to some degree. It's part of the job. But to know that those kids get numbed to all this truly broke something in my heart.
I work in rural medicine now, but prior to that was in hematology, clinical and laboratory. So many a shitty leukemia diagnosis. Plenty of young and old dead adults. But perhaps one of the most heartbreaking things I had to do was when I worked in the lab. I got a call in the middle of the night from one of our scientists with a blood sample they'd received from a rural doctor and had arrived quite late. From a 5-year-old, I think. But when it went through the machine, it had some worrying counts, so the scientist had a look at it in the middle of the night, rather than in the morning. They were concerned enough to get me to take a look and emailed me a bunch of photos taken of the slides. Absolutely raging leukemia. Cancerous cell counts massive. Normal cell counts absolutely tanked. High risk of them just spontaneously bleeding in their gutter brain, something that had to be dealt with right now. But the doctor who requested the bloods couldn't be contacted. So I tried to call the parents, as this kid needs to not just be in hospital ASAP, they need transfusions and to be on a plane to fly about 1,000 kilometers to a specialized PAEDS hospital SEP. Alas, I couldn't get the parents on the phone either. So I called their local ambulance. I sent them at about 1 a.m. to go bash on their door until someone answers and take that kid to the local hospital. In the meantime, I'd be arranging their medical flight to the city. Got all the people along that chain on board. All of that went as smoothly as one could hope, but it broke my heart to think how traumatic that would have been for that family. It's bad enough to learn your kid has such a terrible disease, but to learn by red and blue lights and someone bashing on your door at 1 a.m.? Edit. Just to add, since quite a few have asked, the kid got to hospital, transfused safely, which we had to get sent over from another town, and air transported to the city safely. I didn't get any further communication beyond there, other than some of the additional tests I requested that night. The kind of leukemia they had is very aggressive, but the survival rates with modern treatment are very high, 90% plus at 5 years. So they likely did well. They'd probably be finished their treatment around now. I changed a part. As I recall now, I didn't go into work. I did that from my mother-in-law's home office. The scientist emailed me a horde of photos of the film. Downside of that is we only get paid for call-ins, not calls to us at home, so it meant I was up for hours in the middle of the night for no pay. But that's the life. Palliative care doctor. From a symptom standpoint, late-stage upper GI and pelvic cancers are the worst. It's hard to get people truly comfortable with those types of cancers. Not impossible, but hard, and it tends to be a moving target in terms of med dosages. And it's pretty heartbreaking when you have someone who is close to the end that you can't get comfortable, for patients and families, and also for the care team. Graphic description below elaborating why I hate them. Proceed with caution if you're squeamish. By upper GI, I mean cancers in or around the stomach or upper part of your intestine, in particular, pancreatic, gastric, and biliary. People get a lot of stomach irritation and can get obstructions so that their gastric contents just pool in their stomach and come back out the other direction. They also tend to be very, very painful. A lot of people with those types of cancers ultimately die of gastric outlet obstructions. Everything they eat just comes right back out. And even when they don't eat, they just vomit up their stomach contents. We usually end up putting a tube either in their nose or directly into their stomach to drain the stomach contents to keep them from vomiting as much. But it's still a pretty miserable way to go. TPN, fourth nutrition, doesn't work well in that population once they've gotten to the end stages where they can't get chemo anymore. Can go into reasons if anyone is interested, but would be too much of a wall of text for this point. Pelvic cancers suck because there are tons and tons of nerves in your pelvis. So people tend to get a lot of pain from direct nerve irritation that's hard to control. They can also cause obstruction from the other end. So same deal as upper GI, only poop gets made in the lower GI system. So if you get an obstruction down below, you may be vomiting poop. Also, pelvic tumors tend to be oozy, so people get very unpleasant rectal or vaginal discharge, depending on where the tumor is. It also tends to smell bad, which people have a hard time with psychologically. Cancers both places also tend to like to spread to the lining of your abdomen, which can affect the way that food moves through your intestines and cause obstructions that way. It's also pretty irritating to your intestines. So people with spread to the lining tend to have lots of nausea and vomiting and overall gut unhappiness.
I'm a primary care nurse practitioner. In my second year, I had a mid-50s guy come in on a Friday afternoon with a lump on his neck. He said it had been there a few weeks and getting bigger, but not painful. I examined him, and it was a highly suspicious lymph node. I was a very new clinician, but had worked as a medic for a decade before and a nurse. I got that guy feeling that this guy was sick. I was working for a geriatrician who had been board certified the year I was born, and practicing as well as teaching in our city the whole time. Needless to say, he was well known at the hospitals, so when I had our receptionist ring up a hospital radiology department, they squeezed my patient in that afternoon. I've never had this happen since, but after the imaging, the patient came back to the office. I'm sure he was a bit overwhelmed and just came back on accident. He walks back into the waiting room as the phone rings around 6 p.m., and I'm doing something behind the front desk before I leave for the day. A different reception, not knowing the story, answers the call and says, "Oh yes, she's right here." I look up confused because I never take phone calls at the front desk, then get even more confused to see the patient standing at the front desk. I answer the phone, and it's a radiologist calling to give me a critical read on the head and neck imaging. The patient is staring at me as I get the news that he has a fairly large neck tumor with lymph node involvement. The receptionist later said I kept a generic, serious concern face, but I'm not sure if she was just being nice. I hang up, tell the patient, "Why don't you come back and we'll chat about next steps?" Thankfully, my boss was there, and I quickly debriefed him with a side of, "WTF do I tell this man?" I didn't have the report yet to give specifics. I had no clue what the plan of care would look like for neck cancer. Nor had I ever delivered news like this. Oh, and did I mention it was a Friday in December, and our office had light Christmas instrumentals playing in the background? Boss comes into the room with me and helps me tell the patient, explain we're referring to oncology, that there's a lot we don't know yet, but we'll make sure he gets to the specialists he needs, and be there to walk him through things if he needs. To do this day, if I ever have a fatal illness, I want my old boss to deliver the news. He'd tell you you're dying in a way that was so calming and peaceful, like a yoga instructor explaining how to do a headstand. After we gave him the news, the patient sat there in the small side chair with his winter hat in his hands, Christmas carols in the background, and said, "What do I tell my family? How do I tell my wife and kids?" It's one of the saddest moments I've had. But this is why I love primary care. You get to follow people. We got him into oncology that Monday, and he started chemo within a week. A month or so later, he came back to see me after his heart rate was newly irregular at chemo. Turns out, he wasn't eating or drinking because of pain and lack of appetite. Wrote my first medical marijuana prescription, and he was able to had the desire to eat and drink again. It was a long road, and he lost a lot of strength, but he ended up going into remission and held on to his small business throughout. I got to meet his wife months later. I still think about him from time to time.
I'm not a doctor, but the story of my best friend's sister is especially tragic. She was experiencing painful cramping and heavy menstrual cycles. She had an IUD and went to have it removed, but they couldn't even see it. Her cervix looked like cauliflower. It was uterine cancer, and her fight began. About a week later, she was walking in a store with her mother and was very short of breath. Her mother, who was an RN, called the doc and got her in for a chest CT stat. Sure enough, it had spread to her lungs. She went into the hospital, ended up on a vent, and was put into a medically induced coma. Everywhere they tested, there was cancer, and she was dead within 11 days from diagnosis. 11 days. She was 27.
I had this one patient, 38, 39 male with underlying end-stage renal failure and very poor controlled diabetes mellitus, among other things. Had bilateral below-knee amputation, and he was legally blind, could only see hand movement like 10 centimeters in front of his face. He had exhausted all means of hemodialysis. What I mean by that is, we have to put in a fistula, commonly AVF, from where he could undergo hemodialysis. But all possible sites in his body had failed, all but one, by the neck. So to make sure we got it right, we had to do it under fluoroscopy. Well, long story short, the procedure failed. So what did it mean for him? Death penalty. He cried when he knew of the result of the procedure. Then he asked my specialist, "Can I eat a special local food?" My specialist said, "You can eat anything you want." Now, you have to know, he had been having ESRF for many years, which means many years of strict diet and water restriction, 500 milliliters daily. This includes anything with water, not just drinking water. We were basically just allowing him his last meals, and so he ate to his heart's content for the remaining days that he had, which was a week.
15-year-old kid. Had a headache and stuffy nose for a couple days. Mother thought he was trying to get out of school. Day 4 or 5, he was drowsy and not easily rousable, so presented to hospital. Intracranial extension of sinusitis, subdural empyema, dural venous sinus thrombosis and evolving venous infarct. Large craniectomy to wash out the empyema and allow expansion. Developed large intraparenchymal hemorrhage following surgery. Next day, the empyema started collecting again, even with the open skull and drains in situ. More infarcts, now including in posterior fossa structures. A few days later, developed contralateral empyema, second large craniectomy, more swelling, more infarcts. Life support was withdrawn a few days after that. I think he went from healthy to dead in 2 to 3 weeks. I checked what the lab cultured. I can't remember them right now, but the kid had organisms I've never heard of. Real left field shit. Given how septic he was, they probably couldn't even use his organs. Really sad case.
I'm a high-risk OB doctor. When I was a resident, we had a pregnant woman brought in by ambulance found down in a pool of blood. She was about 36 years old, first pregnancy, about 32 weeks along, husband traveling for work. She had been on the phone with him and he said she stated she didn't feel right. Then he heard a crash and she wouldn't respond. When she got to the hospital, the medics had the Lucas CPR machine going on her and she was white as a sheet. Put the ultrasound on and saw baby in an agonal heart rhythm, last stages before fetal death. Did a stat perimortem C-section right there in the trauma bay. First bloodless surgery I ever did. With the heart not pumping, people don't bleed in surgery. Got baby out, it went to the NICU on cooling protocol but kept seizing due to anoxic brain injury. They withdrew care within hours. Kept working on mom but never got her back. pronounced her after about 45 minutes. When the husband got there about 5 hours later, had to tell him about his wife and baby. I've never heard someone sound like that. Just complete despair. You could hear the brokenness in his screams. I was a new dad at the time. It took me a while to get over that one.
Not a doc, but used to teach lunchtime EFL classes at a hospital, and the heart surgeon comes in with a really long face. He had one kid come in who had no real symptoms, but the valves into his heart were narrowing, so without surgery, he was doomed in the long term. So they decided to cut out one small valve and one big valve and transplant the big valve to where the small valve had been removed and put an artificial valve where the big valve had been. At least that was the gist of it, long time ago, and I don't know medical terminology at all. The transplant didn't take, and the kid died. He'd just come in from an hour of the parents screaming at him for killing their kid. They were taking it especially badly since the kid wasn't displaying any symptoms before the operation. And this guy was really good at his job. He had awards for open heart surgery on premise and did a successful heart and 2 lung transplant of a woman who had lung cancer, spread of her heart. But everyone has things go wrong. Just know I could never do a job where the off days are people die. Really didn't know what to say to the guy.